Have you ever felt your heart suddenly start racing, skipping a beat, or fluttering for no reason? That strange feeling could be more than just anxiety or stress. It might be something called an arrhythmia. In today's video, we'll explain what arrhythmias are, why they happen, the signs you should watch out for, and how doctors treat them to keep your heart rhythm steady and strong. Your heart is an incredible organ. It beats about 100,000 times every single day, pumping blood through your entire body. But it doesn't beat randomly. Each beat is triggered by an electrical signal that tells your heart when to contract. When those electrical signals become irregular, too fast, too slow, or just out of sync, that's called an arrhythmia. There are many different types of arrhythmias. Some are harmless and might just cause a mild flutter. Others can be dangerous and require medical attention right away. The most common types include atrial fibrillation, or AFib, where the upper chambers of the heart beat in a chaotic and irregular way. This can lead to blood clots, stroke, and heart failure if untreated. Bradycardia, where the heart beats too slowly, usually fewer than 60 beats per minute. Tachycardia, where it beats too fast, more than 100 beats per minute while at rest. And then there are premature beats, where the heart adds an extra beat or skips one. So what causes these irregular rhythms? Several things can trigger arrhythmias: heart disease, high blood pressure, diabetes, smoking, too much caffeine or alcohol, stress, or even certain medications can all affect your heart's electrical system. Sometimes it can also be related to aging. As we get older, the heart's electrical pathways can become weaker or damaged. The symptoms of arrhythmia can vary from person to person. Some people feel their heart racing, fluttering, or pounding. Others might feel dizzy, lightheaded, tired, or short of breath. In severe cases, you might even faint or feel chest pain. But here's the tricky part. Not all arrhythmias cause symptoms. That's why regular checkups are so important, especially if you have risk factors like high blood pressure, diabetes, or a family history of heart problems. If a doctor suspects you have an arrhythmia, they'll usually perform tests like an ECG or EKG, that S an electrocardiogram, to record the electrical activity of your heart. You might also wear a Holter monitor for 24 hours or longer, which tracks your heartbeat as you go about your day. In some cases, more detailed imaging like an echocardiogram or stress test may be used to check your heart's structure and function. Now let's talk about treatment. The goal of treating arrhythmia is to restore a normal heart rhythm and prevent complications. The treatment depends on the type and cause of the irregular heartbeat. For mild arrhythmias, lifestyle changes might be all that's needed, such as reducing caffeine, managing stress, and getting enough sleep. Doctors often prescribe medications called antiarrhythmics to control the rhythm or rate of the heartbeat. If the risk of stroke is high, especially in atrial fibrillation, blood thinners like warfarin or newer drugs such as apixaban are used to prevent dangerous clots. For more serious or persistent arrhythmias, doctors can use advanced procedures. One common method is called cardioversion, where an electrical shock is given to the heart to reset it back to a normal rhythm. Another is catheter ablation. In this procedure, a thin wire is guided through the veins into the heart, and heat or cold energy is used to destroy small areas of tissue that are causing abnormal signals. In cases where the heart beats too slowly, a device called a pacemaker might be implanted. It sends electrical impulses to keep the heart beating at a normal pace. And for people at risk of sudden cardiac arrest, an implantable cardioverter defibrillator, or ICD, can be placed. This small device constantly monitors the heart rhythm and delivers a shock if it detects a dangerous rhythm. Alongside medical treatment, there's a lot you can do to protect your heart naturally. Eat a heart-healthy diet rich in fruits, vegetables, whole grains, and omega-3 fats. Avoid smoking, limit alcohol, and exercise regularly. Even a 30-minute walk each day can make a difference. Managing stress through relaxation techniques or breathing exercises can also help your heart stay in rhythm. Remember, the heart is an electrical and mechanical miracle, and when it's out of sync, your whole body feels it. The good news is that most arrhythmias are treatable, and many people live long, healthy lives once they're properly diagnosed and managed. If you ever feel your heart fluttering, skipping, or beating too fast, don't ignore it. Get it checked. Early detection can prevent serious complications and keep your heart strong for years to come. If you found this video helpful, hit the like button and share it with your family and friends, because heart health awareness can save lives. And don't forget to subscribe to Health 365 for more science-backed health advice, tips, and insights every week. Stay healthy, stay informed, and always listen to your heart. It's talking to you every second of the day.